Have you looked at your feet today? Most people over the age of 60 pay attention to their blood pressure, heart, or cholesterol, but very few realize that one of the earliest warning signs of hidden diabetes may appear in a place they rarely examine: their feet. Diabetes often develops silently. It can take years before obvious symptoms appear. During that time, high blood sugar may slowly damage nerves, blood vessels, and the body's ability to heal itself. Many people don't know they have diabetes until serious complications begin. The surprising part is that your feet can often reveal these changes long before you feel seriously ill. A small numb patch, dry, cracked skin, a wound that refuses to heal, changes in nail color, tingling sensations at night. These may seem like normal signs of aging, but sometimes they are your body's way of asking for help. The good news is that recognizing these warning signs early gives you the opportunity to take action before more serious complications develop. In today's video, we'll reveal 9 important foot signs that may be linked to hidden diabetes after the age of 60. We'll explain why these changes happen, what they could mean, and when it's important to seek medical advice. Remember, these signs alone do not confirm that someone has diabetes. Many other conditions can cause similar symptoms. But if you notice several of these changes together, it's worth discussing them with your healthcare provider and asking whether a blood sugar test is appropriate. Early detection is one of the most powerful tools in preventing long-term complications. The sooner diabetes is identified, the sooner treatment and lifestyle changes can begin. Stay with me until the end, because the final warning sign is often ignored, yet it may be one of the most important. Welcome to Dr. Bilal, where we simplify medical science into practical advice that helps you stay healthier, stronger, and more confident after 60. Let's begin with the first 3 foot signs that may be associated with hidden diabetes. Remember, these are possible warning signs, not a diagnosis. However, if you notice several of them together, especially if they continue for weeks, it's important to speak with your healthcare provider. Have you ever felt a tingling sensation in your feet, almost like tiny pins and needles? Or perhaps your feet feel numb, especially at night. Many people assume this is simply part of getting older, but it can also be one of the earliest signs of diabetic nerve damage, known as peripheral neuropathy. When blood sugar remains high over time, it can slowly damage the small nerves in the feet. At first, the feeling may come and go. Later, the numbness can become more constant. Some people describe it as wearing invisible socks. Others say they cannot feel the floor properly when they walk. This reduced sensation can become dangerous because small cuts, burns, or injuries may go unnoticed, increasing the risk of infection. If numbness continues or becomes worse over time, don't ignore it. Early evaluation can help identify the underlying cause before more serious nerve damage develops. The second warning sign is a cut, blister, or sore that takes much longer than normal to heal. Healthy skin usually repairs itself within days or a few weeks, depending on the injury. But diabetes can reduce blood flow and weaken the body's natural healing process. Poor circulation means less oxygen and fewer nutrients reach the injured area. At the same time, high blood sugar can make it harder for the immune system to fight infection. Even a small blister caused by tight shoes can become a serious problem if it doesn't heal properly. This is why doctors recommend that adults with diabetes check their feet every day. Catching a small wound early is much easier than treating a serious infection later. If you notice redness, swelling, warmth, pus, or increasing pain around a wound, seek medical attention promptly. The third sign is dry, rough, or cracked skin on the feet, especially around the heels. As people age, the skin naturally becomes drier, but diabetes can make this problem worse. High blood sugar may affect the nerves that control sweat glands. When the feet produce less natural moisture, the skin becomes dry and begins to crack. At first, these cracks may seem harmless, but deep cracks create openings where bacteria can enter, increasing the risk of infection. Keeping your feet clean and moisturized can help protect the skin. However, avoid applying lotion between the toes, as excess moisture there can encourage fungal growth. If dry skin is severe, painful, or accompanied by other symptoms such as numbness or slow healing wounds, it may be time to have your blood sugar checked. These first 3 warning signs may appear gradually, making them easy to overlook. But paying attention to small changes today could help prevent much bigger health problems tomorrow. In the next part, we'll discuss 3 more foot signs that many people dismiss as normal aging, even though they may be linked to hidden diabetes. These next 3 warning signs show how hidden diabetes can affect not only your nerves, but also your circulation and immune system. Many people ignore these symptoms because they seem small at first. But the earlier you recognize them, the better your chances of preventing serious complications. And don't go anywhere yet. In the next part, we're revealing the final 3 foot signs that many people mistake for normal aging. One of them is often overlooked, but doctors consider it one of the most important warning signs of hidden diabetes after 60. You won't want to miss it. Now we've reached the final 3 warning signs. These symptoms are often ignored because many people believe they are simply part of growing older. However, when they appear together with the other signs we've already discussed, they may indicate that your body is struggling to control blood sugar levels. Sign number 7, swollen feet and ankles. Do your shoes suddenly feel tighter than they used to? Or do you notice swelling around your feet and ankles by the end of the day? Occasional swelling can happen after standing or sitting for long periods, but persistent swelling should never be ignored. Diabetes can damage blood vessels over time, reducing healthy circulation. It can also affect kidney function, causing the body to retain extra fluid. As a result, the feet and ankles may become swollen, heavy, or uncomfortable. Poor circulation can also make it more difficult for nutrients and oxygen to reach the tissues, slowing the healing process and increasing the risk of infections. If swelling appears suddenly, becomes painful, or affects only one leg, seek medical attention immediately, as it could indicate a more serious medical condition. Sign number 8, foot ulcers or open sores. One of the most serious warning signs of diabetes is the development of foot ulcers. A foot ulcer is an open sore that does not heal normally. It often begins as a small blister, cut, or pressure spot that goes unnoticed because nerve damage reduces feeling in the feet. Without proper treatment, bacteria can enter the wound and cause infection. In severe cases, untreated ulcers may lead to tissue damage that requires hospitalization or even surgery. The good news is that most diabetic foot ulcers are preventable. Checking your feet every day, wearing properly fitted shoes, keeping your skin clean, and seeking medical care for even small wounds can greatly reduce your risk of serious complications. If you ever notice an open sore that does not improve within a few days, do not try to treat it yourself. It should be evaluated by a healthcare professional as soon as possible. Sign number 9, loss of feeling in the feet. The final warning sign may be the most dangerous because many people don't realize it is happening. Over time, uncontrolled diabetes can damage the nerves so severely that the feet lose normal sensation. You may no longer feel pain, heat, cold, or even injuries. While this might sound harmless, it actually increases the risk of serious problems. Imagine stepping on a sharp object or developing a blister inside your shoe without feeling it. The injury may worsen for days before you notice it, increasing the chance of infection and delayed healing. This is why doctors recommend that adults over 60, especially those with diabetes or prediabetes, inspect their feet every day. A simple 1-minute check can help identify cuts, redness, swelling, or other changes before they become serious. The important thing to remember is that these 9 signs do not automatically mean you have diabetes. Many other conditions can cause similar symptoms. However, if you notice several of these changes together, don't ignore them. Speak with your healthcare provider and ask whether a blood sugar test is appropriate. In the final part of this video, we'll discuss the simple daily habits that can help protect your feet, support healthy circulation, and reduce your risk of diabetes-related complications. Stay with me because these easy tips could make a big difference in your long-term health. Now that you've learned all 9 foot warning signs, let's talk about what you can do next. The first and most important step is simple. Pay attention to your feet. It only takes 1 or 2 minutes each day to check for cuts, blisters, swelling, redness, changes in skin color, or wounds that are not healing. This small daily habit can help you notice problems early, before they become serious. The second step is to keep your blood sugar under control. If you've already been diagnosed with diabetes, following your treatment plan is one of the best ways to protect your nerves and blood vessels. If you have never been tested but recognize several of the warning signs discussed in this video, consider speaking with your healthcare provider. A simple blood test can often determine whether your blood sugar is within a healthy range. Your daily lifestyle also plays a major role. Eating a balanced diet, rich in vegetables, lean protein, whole grains, and healthy fats can help support stable blood sugar levels. Regular physical activity, even a 30-minute walk most days of the week, improves circulation and helps your body use insulin more effectively. Foot care is equally important. Wash your feet every day with lukewarm water, dry them carefully, especially between the toes, and apply moisturizer to prevent dry, cracked skin. Wear comfortable shoes that fit properly. Never walk barefoot, even inside your home, as small injuries can easily go unnoticed. If you have difficulty trimming your toenails or checking the bottoms of your feet, ask a family member or healthcare professional for assistance. Regular foot examinations are especially important for adults over 60. Most importantly, don't ignore symptoms because you think they're just part of getting older. While aging does bring natural changes, persistent numbness, burning, swelling, slow healing wounds, or loss of sensation deserve medical attention. Early diagnosis can help prevent complications and protect your quality of life. Remember, these foot changes are possible warning signs, not proof that you have diabetes. Only a qualified healthcare professional can make a diagnosis after a proper evaluation and blood tests. Taking action early gives you the best chance to stay healthy, active, and independent for years to come. If you found this video helpful, don't forget to like this video, subscribe to Dr. Bilal, and turn on notifications so you never miss our latest health tips backed by medical science. Thank you for watching, stay healthy, take care of your feet, and I'll see you in the next video.